Thank you, LaDonna. No better way to get the day started, but it's going to be a tough act to follow for the rest of us. But with that, I'd like to introduce Terry Stars. As I mentioned, you will find in your treatment of your bones and joints, it's a team effort from our side, made up of rheumatologists and orthopedists. Rheumatologist, if you don't know, which Terry is one, is the medical component of orthopedic surgeons, meaning they're the doctors that will be doing a lot of the evaluations and the pre-treatment plans for this kind of problem. And Terry's going to talk about boomer bones,
there it is,
arthritis and osteoporosis.
Thank you. Let me say what a pleasure it is to be here with you this morning. You know, Tony and I go back a long time, actually, and you know, we are certainly delighted, really, to be here with you. You know, it's interesting that, you know, as physicians and healthcare professionals, we go to educational programs. And there are a lot of values to that, one of which is to stop and take a look at how we think about things. And that's what my job is this morning. I want to give you an overview about arthritis to show you exactly, let's just see, so we're just doing it with this. Good. I'm going to show you this morning about where we are in 2008 and to try to put this into perspective. And one of the perspectives has to begin with all of the changes that have occurred in medicine. We certainly have had a tremendous amount of change in technology. When we look at the advances of not only of our understanding about body function, but about disease mechanisms. There was an old adage that the doctor held the patient's hand while Mother Nature treated the disease. And that's still very true in that the body has a tremendous healing capacity. But nowadays, we have enormous amount of greater understanding about these mechanisms, specifically as well about the genes. We have 46 genes and how they control all of our different functions and about different problems that we can have. Because nowadays, and I'll talk to you a little bit about how we can target very specifically, or certainly much more specifically, our treatments to the underlying mechanism. What is the problem? What's going wrong in the body? And so how to do it. And we always need to think about how we do it in the most cost-effective way. You know, these treatments are expensive. But we as your advocates really need to think about how to do that. So let's get, so give us the next slide. There it is. I like this little slide. It shows Dr. DeGioia and I what we have to do. And that is that we have to learn new things. And we look at the elephant on the little bicycle there. How do we learn how to do it? Well, the elephant can do it, and so must we. Now, in its various forms, arthritis is really the most widespread disabling and painful disease in the United States, really in the world. And when we take a look, as LaDonna had said, I mean, pain is really the cardinal manifestation, because one challenge as rheumatologists and other healthcare professionals involved in arthritis is there are many different kinds of arthritis. There are over 100 named disorders, but they have in common this one manifestation, and that is pain. That's what brings people to see us. And we have to understand what that pain is and to determine exactly the right diagnosis. And that's one of the take-home messages for you today, is that it is so important that we know what the right diagnosis is. And it takes a lot of energies, both on your part and ours, to figure that out. You know, a challenge with the different kinds of arthritis, with many of them. I remember an older rheumatologist, when I went into practice, said to me, "Terry, don't ever forget that some diseases you tell time on your watch, others you tell time on the calendar." And that's true. You know, we're very impatient. We want to know what the answers are. But some of these conditions, we have to watch them over time to see what we call the evolutionary pattern. When we look at our country, that many people have arthritis. 42 million people have significant arthritis. You know, that's 1 out of every 7 individuals, every 3 families. And there is this increasing frequency of arthritis as we get older. A great challenge indeed. We see the different kinds of arthritis. Osteoarthritis and rheumatoid arthritis are the ones that we're going to be focusing on this morning. And they are the most common. Osteoarthritis affects 32 million people. Rheumatoid arthritis, as we'll explain, is an inflammatory process, and 2.5 million individuals have that. The condition of fibromyalgia is a circumstance in which people have generalized musculoskeletal problems. It is a real condition, and it's really now understood that these people have become increasingly sensitized. Their nervous system's pain processing has been changed. So it really is a common problem. Gout is also common, and over 150 children have arthritis. So what is arthritis? We look at the word arth, Greek for joint, itis, inflammation. Well, that's somewhat of a misnomer because all types of arthritis are not inflammatory. Inflammation can be thought of, think of when you cut yourself and you see the redness on either side. That's inflammation. That's a normal process in our body that helps the healing. But when that inflammation stays persistent, it can cause injury to the tissues, whether it's the joint or other parts of the body, such as like with inflammatory bowel disease. Inflammation, if left unchecked or if it persists, can cause injury to those tissues. As we'll explain, though, all types of arthritis is not inflammatory. When I talk to patients about arthritis, I think you have to begin at the beginning. And the beginning is understanding what a joint is. And when we look and you make a fist here, we're moving our joint. Joints are where bones come together, the union between bones, where we have motion. And there are different kinds of joints in the body, but they all have certain characteristics, certain elements that are important. And kind of a second take-home message is that different kinds of arthritis affect different parts of the joint. Seems pretty logical, and it is true. But when we look at the joint, we see the 2 bones coming together, and we see that bone underneath is a very specialized, that spongy bone underneath is like balsa wood. Actually, that's why it can become injured with different kinds of arthritis. The cartilage is the shock absorber. It's a very smooth surface. It's smoother, actually, than an ice skate on ice normally. And so when problems happen to it, there are abnormalities, not only in terms of the movement of the joint, but of that shock-absorbing capacity. We can see surrounding the joint is what we call the capsule of the joint. The joint capsule is the housing that goes all the way around the joint and has on its inner surface a lining, a membrane called the synovium. Now that synovium is a tissue that makes a fluid. It's like a membrane, it's a filter, and that's what makes the joint fluid. And that joint fluid, we can think of it if you get swelling of a joint, like water on the knee, that's extra joint fluid that's there. But that joint fluid serves very important functions. Number one, it kind of helps to lubricate. It's the oil or lubricant in the joint. It accounts for a fair amount of that. But it is also the food for the cartilage. Cartilage has no blood supply of its own. So cartilage is totally dependent upon that fluid to be nourished. This is why cartilage does not heal up as well as other tissues. Cartilage turns over, parts of it every 3 months, part of it every year. So it just doesn't heal up because it doesn't have that blood supply that comes to it that can assist in that healing process. This is why when cartilage is injured, we have a great challenge on how to get it back into a working order. So that's what the joint is. This is what it looks like under the microscope. And when we look at the joint, we see over here, this is the cartilage right in this area. This is the bone underneath. See how nice and smooth. The capsule is right in this, and the joint lining is there as well. And when we look at the